In the midst of the coronavirus pandemic and as winter takes hold, more people are beginning to worry. How is managing flu different from before the coronavirus? Now, can people still get flu vaccinations? And what are some of the misconceptions about the flu shot? Joining us to tell us a little bit more about the flu vaccination and how we can manage the flu season in the time of coronavirus is Professor Adrian Puren of the National Institute for Communicable Diseases. Professor Adrian, good morning. Thank you very much for joining us on Weekend Dawn. Let's just look at managing the flu during a time of COVID-19. How is that different from previous seasons?
Well, it's not going to be any different, but I think there's a greater emphasis on the need to ensure if there are opportunities to access vaccines, and that will be, especially in the vulnerable groups, and we can certainly go through that, I think it will already be critical. Because the flu virus and the coronavirus cause similar symptoms in people, it becomes very difficult to distinguish one from the other in many cases. So it's likely that if one can certainly protect oneself against the flu in terms of, for example, vaccination, then I think that is a useful opportunity to actually lessen your chances of getting the flu, because they do, as I said, share similar symptoms, for example. But it's quite also important to note that the advice around preventing the flu being transmitted from person to person is exactly the same as we do for the coronavirus. So in other words, physical distancing, the washing of hands, hand hygiene, cough etiquette, the wearing of masks, all of these particular factors are certainly also critical in terms of preventing the transmission of the flu viruses.
Professor Adrian, I just want to also unpack some of the misconceptions around the flu and also the flu vaccines that are available. I mean, how effective are these vaccines in terms of matching them against the viruses circulating? What are the dosages required? And also, what is new related to the flu season at large this time round?
Yes, so in terms of there are different flu vaccine formulations now. And I'll just tell you what flu is, the viruses that are generally in circulation. So there are two types. There's the influenza A and influenza B. And when you purchase your vaccine, it has a combination of these particular viruses. And within the influenza A, there are two subtypes, the AH1N1 and the AH3N2. And as you know, we had a pandemic outbreak in 2009, and so this H1N1 supplanted the previously circulating virus. So the risk groups, in fact, that should get this virus are obviously the healthcare workers that we're really concerned about, and then there are those individuals that are at high risk, for example, individuals that are over the age of 65, in the elderly, and those that have, in the elderly specifically, where they have chronic diseases such as heart disease, stroke or diabetes, asthma, and chronic obstructive lung disease. And then in pregnant women, it's also really critical that they have access to vaccines, as well as those individuals that are immunocompromised, such as those living with HIV and AIDS. And vaccines can be given to individuals above the age of 6 months, so the doses are different in children compared to adults. And the flu vaccine can be given throughout the flu season. It doesn't mean if you've not had the flu vaccine that you cannot get the flu vaccine. You don't get flu from a flu vaccine. You may have side effects, and if you know that you have an egg allergy, then perhaps the vaccine may not be for you. But in essence, you may have some minimal side effects, but you certainly do recover from it. But you don't get flu from the flu vaccine. And I know people are fearful about needles, but I think that's one of those particular things. We don't have the spray or aerolized vaccines available in South Africa. There are also other approaches that you can use to limit the actual experience of the flu. In other words, there's a medication called Tamiflu, but again, this is really not always readily available. It's really for patients who have more severe disease.
Prof, I'm glad you touched on the different vaccines available. I just want to know from you, when ideally is the right time to get that flu vaccination? And could you perhaps also explain to us the difference between the cell-grown vaccines as opposed to the egg-based vaccines, related to the flu in particular?
Yes, so the cell vaccines were obviously the way to go with that is obviously the optimum way, because that will limit, for example, any allergens that you may have. And obviously, you can also improve your yield of vaccine, because one of the major problems is that the availability, for example, in South Africa. So we only get about 2 million doses, I think, both in the public or private sectors. So one can certainly improve the yields of vaccines, and that, I think, will be really critical. If you could just repeat your first question, and I'll go through that.
Just perhaps looking at, when ideally is the right time to get vaccinated. I'm just, as you also explained, the difference between the cell-grown vaccines versus the egg-based vaccine.
So there's no specific. Optimally, you want to be vaccinated just before, within closest to the flu season. So April is a good time. But as I said, it doesn't prevent you from being vaccinated any time during the flu season. So it takes about 2 or so weeks for you to develop immunity, and that immunity lasts for about 6 months. And as you know, if you've been vaccinated this year for flu, you will still need to be vaccinated again next year because of the waning vaccine responses in terms of your immunity, as well as the fact that the flu vaccine mutates quite rapidly, and so you have to change the vaccine each year. Thus far, it's quite interesting. We have surveillance systems in South Africa to determine when the flu season has started and ended and what's the nature of that outbreak. And so far, we actually are not seeing cases of flu as we would normally see. So it looks as if the flu season has actually been delayed, and I can certainly ascribe that possibly to the fact that we've had a lockdown, we've been in isolation, and there's a lot of emphasis on hand hygiene, cough etiquette, and the wearing of masks that probably has affected the flu season thus far.
Prof, speaking of flu indicators, and I just wanted to know, can we expect a flu epidemic this time round? What is the flu forecast for the country, the world at large?
It's very difficult to predict. It's one of the most unpredictable viruses that we do have. And so one season could be very distinct from the other, and in terms of the geographies as well. When you look at, say, New Zealand and Australia, sometimes they have very severe flu seasons, whereas in South Africa we may have very mild seasons. And as you know, in the United States, and that's where they started, that because they've had very severe flu seasons, they've actually added additional flu viruses to their vaccine formulations because certain of the so-called lineages located actually cause severe disease. So it can certainly vary geographically. It can certainly vary from season to season. So it's very difficult to predict. And as I said, this year so far, at least in South Africa, we seem to have a delay in terms of the outbreak thus far.
Prof,